see if the patient feels it. Oh. Smack it.
Can you force that?
Poke on what?
You put force it?
The absence of teeth. They got just enough poking to let somebody go, oh, okay, ow, I feel it. The other thing is gonna be like, a Babcock and an Alice, you're really gonna have to clamp it. That's a pinch. You don't want to pinch somebody either. Probably get offended. It's actually, think about it. Would you rather get pinched by an Alice or poked by a little needle?
Pinch.
You haven't been nothing really, right? Nothing. But an Alice, try getting pinched with an Alice. That thing will hurt. Right? So a hypodermic needle also works too. It's just a little ow. Okay. But so, oh my God, that pinches. Think about it.
I don't like.
Some of you guys are like, no, I hate needles.
Testing that. Would it be the surgeon doing that?
Remember, you guys do not manipulate at all. Anything that I talk about, if it's being done to the patient, you do not do. You anticipate. That's why I tell you how to do these things. So you can say, oh, the surgeon is about to poke the patient. Here's a hypodermic needle. The patient, the doctor should feel for any blah, blah, blah reaction, that. So I'm giving the answer. Because if I just tell you, give the answer at this point, and you don't know, the doctor might not go in that sequence. The doctor might do something different. So I definitely want you guys to think like a surgeon. Think like a surgeon, but just know that you cannot do certain things. Okay? All right, so good. Any questions so far? Is it pretty similar? The anatomy is slightly different, right? Once we get to the specialty, it's different. All right, 10 blades. Do we have 10 blades? Yes. Again, set up the Mayo stand the way you know how to set up basically. Now, to the specialty. I had a book earlier, but I'm not. The book, guys, as it goes into the procedures. Someone asked me, how do I know how to set up the Mayo stand? Your book tells you. It just doesn't tell you, here are the things for a Mayo stand. When it talks about the procedure, it says pretty much for a C-section. First thing the surgeon is going to need is to make an incision. The incision is made abdominally. The doctor can choose to do a midline or transverse type incision, or to be specific, a finished steel. Traditionally, we like to go transverse. What instrument do we put on the field for that? Scalpel. Which blade?
10.
10. Again, the number 4 and number 20, guys, is very rare. It says to use a number 4 and number 20 on some certain things. Your book does say a number 10, though, because guess what? 20s are almost non-existent. They're very hard to find. So 10 blades, right? Next, it might say something like, okay, the doctor needs to continue to make his incisions, right? Needs to continue to dissect. Again, what instrument could we possibly have on there? Continue to dissect. Come on, guys, rapid fire. Absence is for holding, for accepting. ESU, yes, ESU is one. Rapid fire, guys.
Hemoclip?
What?
Hemoclip?
Hemoclip? To dissect. Let's think again. Kelly, what else?
Mixed already. Mixed already.
Mixture right angle, we're not that deep yet. Come on, guys, this should be rapid fire. If you're not there, you need to go back and evaluate how you set up your case. Tonsil, possibly. Kelly, Eon, Metzenbaum, ESU. Those are the simple things that I told you guys on how to dissect the body. Is there items that accompany that? Peanut butter and jelly. Now we can start adding the bakies, absence of teeth, and so on, so depending on what layer. What layer are the absence used on? Skin, right? And only. You shouldn't be going deeper. Let's go into the next forceps that we need to accompany dissection. Rat tooth, plain, depends on your doctor. More than likely it's going to be rat tooth. Remember, plain brushes. And then now we go deeper into the softer, delicate areas. What do we use? The bakie. Again, guys, we give those instruments to accompany. The bakies, those absence, those rat tooth, are the, again, jelly to the peanut butter. The peanut butter and jelly. Okay? So you know what to have up here. Now we're going down, cutting. Remember the layers again. There's 2 strap muscles that come here, the rectus abdominis muscles that attach. Then there's that transversalis fascia that holds it all together. We're going to have to take those two apart. So what instruments can we use to hold on to those tissues so that we can pull them apart? Remember, what are these things? The cokers, yes, definitely. The cokers usually hold on to these areas where there's fascia and muscle and where it meets together. And then your doctor needs to cut into it. Give you an instrument that you might use to cut into it. Rapid fire, guys, come on. Bobby? Never a Bobby when you're into that deep layer. Why? There's gas in here, right?
15.
Don't want to boom. Mixture writing, we need a cut.
3 long.
3 long. Okay, a blade.
15.
As simple as that is, you guys are thinking way too hard. You guys are on the wrong layer. Okay? Never an ESU around the peritoneum or those last fascial areas. You can go boom. Okay? A right angle is not sharp enough, especially for fascia. Remember, this is fascia and muscle. A right angle is not going to do anything to this. We need something sharp. In this case, being a knife. So we need another clean blade. A long blade, possibly. Remember, this belly's this big. Now, can it be more? Again, could have maybe mother have grown some protective layers there that we need to get in deeper? Okay, so maybe, possibly, this is where you have to pay attention to what's going on. Will a Metzenbaum work? Metzenbaum works if you wanted to, but you're going to have a hard time. Get a piece of paper. Have you guys ever tried cutting a piece of paper straight down into it? Is it going to happen? So what do you think is going to happen to the body? Is it? What do you need to do? You need to pinch it and then cut it, right? So again, Mike the doctor needs to pinch those layers and pick them up. Possibly that's where you get things like, again, hemostat, Alice's, to pick up those layers so the doctor can cut. But the doctor's in a hurry, so what does he use? 10 blade. And he makes a nick cut. Okay, what's a nick cut? He cuts just enough so that you can continue to cut. The doctor usually continues to cut that area along the sides with what? Not the blade, remember, if we continue with the blade, we can oopsie daisy cut something, right? Metzenbaum is usually the scissor we use, right? But in this case, what are we cutting? What are we cutting? What tissue? Muscle and fascia. Is Metzenbaum going to do that work? No, so now we think like a Mayo scissor, curved or straight?
Curved.
Good. Remember, curved is always the instrument we use in the body. Straight is for accessory stuff like cutting paper, sutures, blah, blah, blah. Very good. A lot of times you'll see the doctors will go in there, and we've done it a lot too, where the doctor points at me and says, "Grab your side, you guys that side, what do we do? Stretch." That's all it takes, really. Because remember, fascia, once it's cut, and muscles, once it cuts, it's fiber. It's like cutting a salad. Okay? It's the same sense when you go in this, so you gotta be careful. Okay? Again, using hands and fingers and stuff is it. We should be using instruments. So please, I want you to know the difference between clinical and study versus practical and again, clinicals out there. Right now we have a clinical lab, but that's clinical practice. Know the difference between the two. This is what is a rule and what's set. Out there is what needs to get done. I want you to remember that when you come back and you're answering questions for your test, so make sure you remember this, not that. Okay? So you shouldn't be using your fingers. So what can we be using to stretch that out?
Retractors.
Retractors, very good. Do you have the retractors in here necessary for it?
Yeah.
Sure. You got Richardson's? Your USA's are too small. Those would be nice to start. Your Goulets are even better because they're wider, right? So you can get more of the area. And then your Richardson's are nice and deep, so you can get in there. Devers are going to work also, especially if the doctor needs to get into the belly because the uterus is bringing down there and pick it up. Again, so these instruments might be there. The only different retractor, like we mentioned, is going to be possibly the flatter blade. Okay? So look it up when you guys get a chance. Just like C-section, flatter blade, there's going to be tons of them. Okay? But the main one is going to be Dr. Deely had his blade where it was shaped, again, circular, so you can get what? The head through without, oops, think. Okay, so we have a Deely bladder retractor. Alright. This was the wrong tray. I guess they picked the wrong one. It should have been the other one with the tractors. But they didn't know until they opened it. Okay. Now, getting there, is it going to be bowel in the way? So what can we Retract it? Yeah, we can